Good morning.
Good morning.
Welcome to the South Top Library. We welcome you and we thank you for taking time out of your day to come and share this morning with us. I am Joe Lehman, Regional Manager for the South Top region of the Cobb County Public Libraries. An awesome and informative program is planned for you today, and we hope that you will enjoy. So thank you for being with us today. Today we have distinguished panel members from the Morehouse School of Medicine, and Dr. Charity Mitchell will introduce our speaker for today, who is Dr. Charity Mitchell will introduce our speaker today, who is Dr. Rhonda Holliday.
So glad that you all could be a part of this wonderful occasion today. We have a great program for you. But today I am here, I'm tasked with introducing our guests online and in person. I'm tasked with introducing Dr. Rhonda Holliday, who is a dear colleague of mine and also an expert in her field. Dr. Rhonda Holliday, PhD, is a professor in the Department of Community Health and Preventive Medicine at Morehouse School of Medicine with a secondary appointment in psychiatry and behavior sciences. She conducts research on HIV and substance use prevention, minority health issues, and community-based participatory research. She has focused on populations impacted by the criminal legal justice system, both adolescents and adults. Dr. Holliday has served as principal investigator for the Morehouse School of Medicine's Prevention Research Center's core research project examining HIV prevention in adolescents and emerging adults for over a decade. That's a long time. Dr. Holliday is the Community Engagement Core Director for the Center for Translational Research in Health Disparities at Morehouse School of Medicine and the co-director of the Community Liaison Core for the Deep South Research Center on Minority Aging Research in Health Disparities at Morehouse School of Medicine, and the co-director of the Community Liaison Core, did I already say yes, for the Deep South Research for the Minority Aging Research House at the University of Alabama at Birmingham. She also serves as the co-director of the Health Equity Scientific Working Group with the Emory Center for AIDS Research. Dr. Holliday is a strategic leader for the Communications and Dissemination Core with the National COVID-19 Resiliency Network, where she works with a team of partners and many community members to develop culturally and linguistically appropriate health communications. She has conducted research in the United States, South Africa, and Switzerland.
Swaziland.
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 Ooh, I'm sorry. Swaziland. Well, we're speaking for the future in Switzerland. She's gonna get there. And her work has been funded by NIH, CDC, and SAMHSA. In addition to her scholarly activities, Dr. Holliday is the chair of the Social and Behavioral Institution Review Board at Morehouse School of Medicine, where she has worked to train community members on human subjects research protection. She also serves on the board of directors for the Academic Consortium for Criminal Justice Health, where she is a founding co-chair of the Racial and Social Justice Work Group. Dr. Holliday also serves as the co-chair for the Prevention Research Center's Anti-Racism Work Group. And she has previously served as a health equity ambassador with the American Psychological Association. If you all could please give me the joy and also Dr. Holliday a warm welcome and welcome her to the podium as she discussed her area of expertise as it pertains to health literacy.
Thank you for that very warm introduction, Dr. Mitchell. I appreciate it. It's always interesting to hear your own bio being read. I wrote it, but still it's kind of interesting to hear. So today I am going to talk to you all about some of the work that I have been doing around HIV and particularly around PrEP and educating community about PrEP awareness. So, next slide. Okay, so we're going to talk about awareness, knowledge, and uptake of PrEP. Next slide, please. Okay. So when we look at this map, what we see here is that the burden of HIV is disproportionately located in the southern United States. The South accounted for 51% of new HIV infections in 2020, while only representing 38% of the total United States population. 8 out of the 10 states with the highest new HIV infections are located in the South, and 9 out of 10 metropolitan statistical areas with the highest new HIV infections are also located in the South. And then according to the Pew Research Center, 59% of Black Americans lived in the South in 2021. And that'll come into play a little bit later in the presentation. Next slide, please. So when we look nationally at who is being impacted by new HIV diagnosis, we'll see that people between the ages of 13 to 34 accounted for 56% of new HIV diagnosis in 2021. And then Black African Americans accounted for 40% of new HIV diagnoses during that same year. And what is also interesting to note is that the rates are similar for both men and women, for both Black men and Black women when you're looking within those gender categories. Next slide. Okay, so now let's look at Georgia. Let's talk about what's going on in Georgia. In 2022, there were 2,575 people who were newly diagnosed with HIV/AIDS. 69% of those were either diagnosed, received a late HIV diagnosis or stage 3, which is actually, they were diagnosed with AIDS. This is particularly concerning and has implications for reducing the spread of HIV because these numbers suggest that people are not getting tested. So we need to do a better job of getting people tested. Next slide, please. So just looking a little bit more at the numbers, when we look at gender, we'll see that men represent the highest percentage of HIV diagnosis, accounting for about 78%. Next slide. And Blacks, African Americans accounted for about 67% of new HIV diagnoses in Georgia. Next slide. And then for the age, about 70% of new HIV diagnoses are for those ages 13 to 39. While the numbers decrease, while we see a decrease in the numbers as age increases, these numbers are still somewhat alarming. So in particular, I'd like to point out that for those who are 40 to 49, it's about 13%. But even among those who are 50 to 59, the rate is a little over, slightly over 10%. And then around 5% for those who are 60 plus. So we still have, to me, these numbers are alarming. We would hope to see definitely decreases among all those age groups, but looking at new diagnoses among the older population is kind of concerning. Next slide, please. And then in terms of transmission in Georgia, the majority of the transmission is male-to-male sexual contact, accounting for about 66% of diagnosis. Next slide, please. All right, so now we're gonna look at, so we've looked at Georgia. So what's going on in Cobb County? And so I pulled data from the latest report from the Georgia Department of Public Health, where they looked at the health districts in Georgia. And so Cobb is located in Health District 3-1, which is a combination of Cobb and Douglas counties. So in 2022, there were 4,801 people living with HIV, but there were 211 newly diagnosed cases. Next slide, please. Okay. And so when we look at that comparison between the county, specifically looking at Cobb County as compared to the state in the region in the United States, you'll see that the county is just slightly lower in terms of the rate compared to the state, but it is higher than the region, the southern region, and also higher than the United States. Next slide, please. Okay, so looking a little bit further, the diagnosis in this public health district really falls along similar lines as we see in the state of Georgia. So you're going to see higher rates among men, next slide, and also higher rates among African Americans. Here it's about 65%, which is close to what it is in the state. Next slide, please. And then when we look at age, again, you're going to see that the majority of those diagnoses are going to be between the ages of 13 and 30. Again, there will be a drop off as the age increases, but again, we're still looking at rates even in these older ages that are above 5%. Next slide, please. And then transmission, again, the majority of cases are going to be male-to-male sexual contact, representing about 77% of cases. Next slide. Okay, so I want to talk about, now that I've given you sort of a snapshot of what's going on nationally, around the state as well as locally, I want to talk about what are some of the things that we're doing as a nation to address HIV. There is an HIV National Strategic Plan, and the one for 2021 through 2025 focuses on these priority populations. So gay, bisexual, and other men who have sex with men, particularly Black, Latino, American Indian, and Alaska Native, Black women, transgender women, youth ages 13 to 24 years, and then people who inject drugs. Now you'll see I have some of those highlighted, and I highlighted those because that's where my research focuses on. So I highlighted those for that particular reason. Okay, next slide, please. Excuse me. So in 2019, so we have our national HIV strategic plan, and then in 2019, there was a plan that was introduced called Ending the HIV Epidemic. And so this is a plan for America. And this plan actually set a goal to end the HIV epidemic in the United States by 2030. So we're in 2024 now, so we have 6 more years to go, okay? And so these are the strategies, is to diagnose people as early as possible, treat people with HIV rapidly and effectively, to get to viral suppression, prevent HIV transmission with proven interventions that include pre-exposure prophylaxis, which is also known as PrEP, as well as syringe services programs, and then respond quickly to potential HIV outbreaks and get the needed prevention and treatment services to people who need them. Next slide, please. So now the rest of my talk is really going to focus on PrEP and some of the work that we have done around PrEP and that ties to health literacy. So PrEP is available it's a preventive measure that is available in a pill as well as an injectable. The injectable was approved, I believe, around 2019, 2020. The cost for PrEP can range from anywhere from $13 to about a little over $1,700 per month. So that depends on your insurance coverage. So PrEP is covered by insurance. But if you're uninsured, that's where we have some barriers in terms of access to PrEP because it's really expensive. And so you can imagine that if you're uninsured, where are you going to get about $1,700 a month to access PrEP? There are payment programs that are available, and Gilead, who has one of the patents for one of the medications, actually offers a program where they provide some financial support to pay for PrEP. Next slide, please. Okay, so what is PrEP? So when taken every day, when the pill is taken every day, PrEP has proven to be safe and highly effective for preventing HIV infections. It's still recommended that you get testing for HIV every 3 months, and that HIV negative persons at significant risk of HIV infection from sex or injection drug use, that's who it's recommended for. Excuse me. And those can include people who are in an ongoing sexual relationship with an HIV partner, gay or bisexual men with a history of unprotected sex, or men who have been diagnosed with an STD in the past 6 months, as well as heterosexuals with a history of inconsistent condom use with high-risk sexual partners of unknown HIV status. And then injection drug users in the past 6 months with a history of shared needles or who have been in drug treatment in the past 6 months. Women with HIV partners who are considering getting pregnant, it is recommended that you do talk to your physician about PrEP. It is not for persons in mutually monogamous relationships with partners who recently both tested HIV negative. The important part here is the recently tested for HIV negative, okay? So that says that if you are in a monogamous relationship, you still need to go and get tested for HIV because things happen, okay? Sometimes mutually monogamous isn't always mutually monogamous, okay? Next slide, please. Okay, so there has been a concerted effort to do some education around PrEP to increase people's knowledge of PrEP as well as to increase access to PrEP. And so this slide shows that over roughly almost a 10-year period, the number of PrEP users, and so there has been an average increase of about 56% per year, which is really good, okay? It's not where we need to be, but it is really good. So you can see the figure on the left versus the figure on the right in terms of the number of people who are using PrEP. Next slide, please. And so when we look a little bit further into the data, particularly when we're looking at race, ethnicity. So again, what you'll see here is that the rate of PrEP use among Black Americans is low. When we compare that to the percent of new HIV diagnosis. So you'll see that the rate of diagnosis in 2020 was 42%, and the rate of PrEP use was only 14%. That's a gap. That's a significant difference. There was a gap for Hispanic Latinx population as well, although not as great as the gap for Black Americans. And then for those who identified as white, what you'll see is that there's actually more people on PrEP than those who are newly diagnosed. Okay, so we have some work to do in terms of getting the information out about PrEP. Next slide, please. Okay, And so here, this just shows, I was looking for some data on PrEP use in Cobb, and so this is what I was able to find. And so what we'll see is that there are about 918 PrEP users in Cobb County as of 2022. The majority of them are men, so well over 90%. And our greatest age, about a little over a quarter, are represented in that 25 to 34 year age range. Next slide, please. And this slide just shows that over the last 10 years, there has been a steady uptick and increase in PrEP. So that's a good thing, okay? So what I think this shows is that this is probably a result, or more than likely a result, of increasing knowledge about PrEP and the benefits of PrEP, and then also increasing access to PrEP. Next slide, please. Okay, so I want to talk now about some recent research that we have done with emerging adults on college campuses, as well as Black women in the Metro Atlanta area. Next slide. So Project Take Charge is a project that we are currently wrapping up. We started this project in 2019. We've had a lot of challenges with this project because right when we were getting ready to start, here comes COVID. And we're working with kids on college campuses. And as you know, the campuses shut down during 2020. So there were some challenges, but we were able to, I think, do some really good work. So Project Take Charge is an HIV prevention intervention that we implemented on the campuses of 2 historically Black colleges and universities, as well as 1 minority serving institution here in the state of Georgia. Next slide. Okay, so I'm not going to go in detail about the actual project, but I do want to focus on some of the work that we did around PrEP awareness. So this is just some research that we were able to find, but what has been reported in the research literature is that African American college students are willing to take PrEP. Their willingness to take PrEP is really influenced about their existing beliefs about medicine. So if they have more positive beliefs about medicine, they were more willing to take PrEP. And so those with less positive views about medicine were less willing to take PrEP. Specifically looking at women who attend HBCUs, there's a study by one of my dear colleagues, Rashida Chandler, who's at Emory, found that there is acceptability of PrEP education, so there is a desire to want to know about PrEP, but there is a need for some socially and culturally relevant messaging to increase PrEP uptake. And if you think about what you've seen in terms of advertisement about PrEP, and you may not even recognize it. You may see commercials for Descovy or Truvada. And if you just think about those commercials, or when you see those commercials, and you see who's pictured in those commercials, they don't always have Black women in those commercials. And so not seeing yourself in that advertisement can lead you to say, well, this is something that is not for me, or something that you may not necessarily pay attention to it, okay? And then another study found that among HBCU students, 52% were aware of PrEP, 58% would take PrEP, and PrEP was acceptable to those who perceive themselves to be at high risk. Okay, next slide, please. So this is kind of a boring slide. So what we did is we held focus groups with the students on these college campuses. And these were the questions that we asked. So we wanted to get at their knowledge and beliefs in self-efficacy. I will say that originally we weren't going to, the focus of the study was not really on PrEP, but we decided to ask some questions about that. And so, next slide, please. And so what we found from our focus groups is basically these students didn't really know about PrEP. They were generally not aware of PrEP. Students who were aware of PrEP did not understand how it worked. They didn't know where they could access PrEP, but they did indicate that they did have a desire to have some information about PrEP and education about PrEP, and as well as access to PrEP on their campus. Next slide, please. And these are just some quotes that sort of illustrate what we heard in the focus group. So we had one person who said, "I don't. It has something to do with HIV and helps to prevent it somehow. I just don't know the actual details." Another person said, "I think PrEP, you have to take it every day so that it's in your system so that when you do have sex, I don't know, it protects you, I guess, from developing HIV, I believe." And then finally, they always say in the commercial to go ask your doctor, but that's about it. That's all I know. So again, these quotes really illustrate really the lack of knowledge about PrEP. There was some kind of idea about PrEP. I've heard of it, but I don't necessarily know what PrEP is. Next slide, please. We also did a survey on these campuses for the students who were enrolled in the research portion of the project. And so they were students participated in a survey that was self-administered. It was an electronic survey and it took about 20 or 30 minutes to complete. We had 164 out of 273 who completed the survey. And then of those, the data that I'm going to report on is from 162 of those who were eligible. We had some who were not eligible for the study. Next slide, please. Okay, so again, these are just some of the questions that we asked, but we did ask, there were 8 questions that we asked about PrEP awareness and willingness to take PrEP. We also, before we even asked about their willingness to take PrEP, we asked 2 separate questions. So the first question was, have you ever heard of PrEP? And so what we found with that data from those responses is that it was almost half and half for those who had heard about PrEP and those who did not hear about PrEP. It was around 46 to 48% for both. Slightly more had not heard of PrEP. And then we had about 10% of those students who said, I don't know. I don't know if I've heard about PrEP. So then we asked another follow-up question where we specifically said, have you ever heard of Truvada or Descovy? Because those are the words that you hear in the commercial. And so we wanted to see their awareness of PrEP then. And so when we looked at that data, what we found is that there was an increase in the people who said, no, I have not heard about PrEP, but that was mainly from those who were in that 10% category who did not know. The majority of them moved to the category of, no, I have not heard of PrEP. So I thought that was pretty interesting, given the names. I said, okay, yes, no, definitely for sure I've not heard of PrEP. Next slide, please. Okay, so these are just some of the demographics. So our students were 98% were majority Black, non-Hispanic Black, over 80% identified as being heterosexual. We had more women in the study than men, and then 82% of them said that they were single. Next slide. Okay, and this just shows the breakdown by classification. So we were almost evenly split or had pretty similar numbers between freshmen and juniors, slightly fewer seniors, and we did have 1 or 2 who reported being graduate students. And I will say that the age range for this particular study was 18 to 24. So the graduate students definitely make sense. Next slide, please. Okay, so these are the questions that were asked, and these are the responses about their willingness to take PrEP. So the questions centered around their willingness to take both the pill form of the PrEP as well as the injectable form of the PrEP. These questions were based on a survey that we found in the literature. We adapted it to add in the questions about the injectable form of PrEP. Again, this was something that was new, that had just been approved by the FDA, and so we wanted to get some information about that. And so what we found is that about a third of the participants were willing to take PrEP. With willingness to take PrEP, in the pill form, if it was shown to be 75% effective in preventing HIV, was endorsed by about 44% of students. And the willingness to take the injectable form, if it was shown to prevent HIV, in 75% of the cases, being endorsed by 36% of the students. So there seems to be a slight more of a willingness to take a daily pill as opposed to an injectable. I wish we had asked questions about why that is, but I think that's an interesting finding. Next slide, please. And so from this particular analysis, what we concluded is that there is definitely an increased need for education and awareness about PrEP on these campuses. That we had a slight majority of the students who had not heard of PrEP even after being provided a description of PrEP, and then about a third of the students were willing to take PrEP. But again, if that was proving that it was at least 75% effective. And PrEP it's really, I think, in the upper 90s in terms of its effectiveness. And so there is an opportunity on these campuses to provide that education for those students. So this can be done by using student-led education. That was something that the students said that they really would like to have, is to have information provided by their peers. And as you know, I sat in the focus group. Sometimes my feelings were a little hurt when they talked about older people. And I was like, oh, they're talking about me, I'm old people. But it's really important for them to get information from trusted sources and peers who have been educated, not just anybody, but peers who have been educated about HIV, about PrEP, about HIV prevention, were some of their trusted sources of information. And then also strengthening some of the partnerships with community-based organizations that can provide access to PrEP, and as well as PrEP education. So the second study that I want to talk about is our Pro-Sister study. And so this study was focused on, Pro-Sisters was PrEP outreach for Black women by Black women. And so this study was focused on working with women specifically in Cobb and Gwinnett counties, which was interesting. So the funding announcement that we responded to for the grant specifically asked us to work with Cobb and Gwinnett counties. That's because Cobb and Gwinnett are part of the priority geographical areas for the ending the HIV epidemic. So they did not specify Fulton and DeKalb. We had about 2 weeks to put this grant together. And as Dr. Mitchell mentioned in my introduction, a lot of my research is really community engaged, community participatory research. And that posed some challenges when putting together this grant, because a lot of the work that I have done has been in Fulton and DeKalb counties, not as familiar with Cobb and Gwinnett County. And so we proposed a community engaged approach for this particular project, working with community-based organizations. But a lot of that takes time in building that groundwork and building that trust. And so as we proceeded with this study, definitely that became evident in terms of us being able to recruit women in both Cobb County and Gwinnett County. So next slide, please. So just as a brief background, when we look at PrEP in African American women, There's a general lack of awareness of PrEP. There have been some mixed results in terms of their willingness to adopt PrEP. And some of the barriers to PrEP include lack of information, medical mistrust, low perceived HIV risk, stigma, and a fear of adverse consequences, so those negative side effects from taking PrEP. Next slide, please. Okay. So our study was focused on women who were 18 and older. They had to be sexually active, not pregnant or planning to be pregnant within the next 6 months, have not previously participated in an HIV intervention, and currently not on PrEP, and of course they had to live in Cobb or Gwinnett County. Okay, next slide, please. So our plan was to collect data, was to implement an intervention that actually focused on what we call the social determinants of health. And those are things that can have an impact on whether or not people are able to access health care, or people have the ability to get the care that they need. So this can be things like employment, education. So we wanted to focus on addressing some of those social determinants of health to hopefully reduce some of those barriers to access PrEP. So that's kind of what we proposed to do. And so we were going to pair the women with community health workers who would assess their needs and help connect them to services that they needed. But again, we had some difficulty in terms of actually recruiting the women. So what we have ended up doing is really just collecting the baseline data. We weren't able to enroll the women in an intervention before the funding for the study ended, but we are still collecting some of that baseline data. And so I want to talk about some of the preliminary results. We've just done some preliminary analysis. Actually, one of my graduate research assistants did some of the data analysis with our baseline data. Next slide, please. Next slide. Okay, so she was interested in looking at their awareness of PrEP, their willingness, as well as their trusted sources of information. And so for PrEP awareness, we asked a question, three questions. Before today, did you know there was a pill that can prevent HIV infection? And we asked the same thing about the injectable. And we also asked, have they ever heard of the medicine pre-exposure prophylaxis, or PrEP? Those were a yes/no response. We asked one question about their willingness to take PrEP. So with all of their knowledge and understanding, how likely were they to start PrEP today? And those responses range from not likely to extremely likely. And then we asked about their trusted sources of information. So how likely are you to request information on PrEP from either a community organization or your health provider? And again, those responses range from not likely to extremely likely. Next slide. So this data is based on responses from 19 women. So again, very preliminary, not a very big sample. So interpret these with some caution. So our mean age was 29 with a range of 19 to 52. The majority had an income that was less than or equal to $50,000. About 74% were heterosexual and 79% were single, never married. Next slide, please. Okay. So for PrEP awareness, 74% of the participants had heard of PrEP, and 71 who were aware of PrEP knew that the HIV infections could be prevented with the pill, but only 43% were aware of the injectable method. Next slide. And so when we looked at their willingness to take PrEP, again, that's that question I asked with their current understanding. would they be likely, how likely would they be to start PrEP today? Only 26% of participants said that they were likely or extremely likely, somewhat or extremely or somewhat likely to start PrEP. Next slide. And then we had 53% who were extremely or somewhat likely to request information from a community organization or their healthcare provider about PrEP. Next slide. Okay, so I just want to talk about, again, I detailed some of the challenges with this study. So we did have a community advisory board for this particular study, but we still had some difficulty in terms of engagement with community-based organizations in both Cobb and Gwinnett counties. So we're still continuing to work on that and build those relationships. And so what we actually ended up doing was expanding to Fulton and DeKalb counties as well. And quite frankly, we probably should expand to Clayton County as well, because that area has a really high rate of, it's very similar to Fulton and DeKalb counties, but it's not part of the ending the HIV epidemic, which not quite sure why, but it definitely should be. And then the funding for the study ended because it was tied to another grant where that funding ended as well. And so we were unable to actually implement the intervention. What I do hope is that, again, we're focusing on collecting some of that baseline data still. And so what I do hope is that once we collect this baseline data, then we can use that data to help write another grant application to really do what we wanted to do in the first place. And I will say that this study was also conducted here in Georgia as well as in Kentucky. So I worked with a colleague in Kentucky. So you may be asking, what do these studies have to do with health literacy? Well, what I hope I have demonstrated in this brief presentation is that there is a need to increase knowledge about proven effective interventions for HIV, and particularly about PrEP. And so the way that we can address this in Georgia, in Cobb County, as well as other counties in the metro area, is by increasing awareness about prevention measures that are available and making sure that people understand their personal risk for contracting HIV. And so, again, a lot of that will be centered around some of the messaging that we do around PrEP to make sure that we are including those who have an increased risk for HIV, so that and then also addressing some of those access issues as well. But it's really important for people to know that these preventive measures are available, including HIV testing, including using condoms. So things that we have known about for years, not just our new interventions, but things that we have known about for years, increasing HIV testing. That is one of the ways that we can prevent the spread of HIV, not only in Cobb County, but in the state of Georgia.